Make sure your name reflects the one that you registered with. Welcome to the April Quarterly Suicide Prevention Coalition meeting. I'm stalling for just a minute or so that people have time to log in before we dive into our morning together. All right. We are recording today, so we would like you all to stay with us, but you can always revisit this later on and share it with others who maybe weren't able to make it today. So, all right. So, good morning, everyone. My name is Diana Gutierrez, and I am the Riverside County Prevention and Early Intervention Manager with Riverside University Health Systems Behavioral Health Department. I also serve as a co-chair for your Suicide Prevention Coalition, and I welcome you to this morning's quarterly meeting. Oh, there I am again. And also my co-chair, Rebecca Antion, who is the Public Health Injury Prevention Services Program Director, and she will be talking with you in just a few moments. So we just want to make sure you know who your coalition leadership team is. And now we want to know who all of you are. So we're going to do a quick poll and learn a little bit about who is in the room with us today. So hold on while I grab my poll. All right. Just a quick poll, 4 questions only. So we just want to know what region you represent, who you serve, what best describes your work setting, and then for fun, as we're thinking about strengths approaches today, we thought we wonder if you were a superhero, what would your superpower be? And we want you to write your answer in the chat so everybody can see it. I always find it's a little bit easier to put those answers in the chat. So if you were a superhero, what would your superpower be? Let's see. Okay, we have about 45% of people participating, answering the poll. I'm gonna give you guys a couple more minutes. Oh, I'm liking this answer to question 4 that people are putting in the chat. Okay, so Nisha wants to inspire people. I hope we do that today. Oh, Marilyn, remember everything. That would be amazing to be able to, well, maybe it wouldn't be. I don't know. Mind reading, Dakota, a prehensile tail, so I could hold more things at once. A tablet, a phone, and a bunch of donuts. Okay. All right. Mind reading, flying, healing, instilling calm, healing. Yeah. Yeah, Dr. Mates, because we want to put your answers in the chat. So please put your superhero power in the chat. Selectively reading minds. Andrea, that I like that idea. Selectively. All right, very good. All right, we have almost 80%. Let's see if we can get to 80% of people answering this poll. Teleportation. Yes, that would be amazing. There's like 3 of you. Yeah, I think I agree. I think I want to be able to teleport. All right. I'm going to give you 30 more seconds. Time travel, that's a good one. All right, very cool. We're at 80. I'm going to go ahead and end the poll. Let's share results so we can get a sense of who is with us today. So that's awesome. We have a pretty good spread across county. That's why we've kept this meeting virtual, because it gives everybody, I think, a little more access, and a lot of you that are serving countywide. So that's awesome. And across the board, people that are serving folks across the whole lifespan. So also really important because, right, suicide prevention and what we are learning here really is it takes a village, it's a community, and everyone can be impacted. So all the information we share is really relevant to the entire community. And then we could take a quick look at who's with us today. So we've got some of our behavioral health partners, other county agencies and departments with us. Schools, higher ed, glad to have you. Community-based organizations, some faith-based, hospital first responders, welcome. And so you can take a look and see who's here and who's missing and who needs to hear this important information about suicide prevention. So we ask all of you, if there's somebody that you think should be on this list that isn't, help us out. Let them know about us. Give them the information. We do these meetings every quarter. And so we would love to have them be a part of that. And then take a look at the chat. I was sharing some of them already. And you all have a chance to take a look. And for those of you that need to think on it a little bit more, feel free to add those thoughts in throughout our morning together, thinking about all of our strengths. So terrific. Thank you guys for participating in that. And now that we've got a sense of who's here with us today, let's dive into how we're going to spend the time. Rebecca, I'll have you talk about that.
Yeah. Okay. Well, yes. So today's agenda is going to cover a few different presenters with us today. We have first, as we always do, we will be giving a quick overview of our Suicide Prevention Coalition for those of you who are new to this today. And then we also will bring in our first presenter, Jasmine Brooks Stevens, who is going to talk about strength-based approaches to suicide prevention in the Black community. We also will hear from Hazel Lambert, who is going to share more about the African American Wellness Advisory Group. And then we'll spend some time with Q&A, and we also will share some closing announcements with you. So a very packed agenda that we have to share with you today. And then just to give you an idea about who we are and what our beliefs are in our coalition. Excuse me. We really recognize that for some this may be familiar, but for others it may be their first time hearing about this. So our beliefs are that suicide is often preventable with the right knowledge and skills, and that everyone can play a role in suicide prevention regardless of background or experience. And so that's why we are so excited to see such a diverse group of people here with us today. And then when we look at our vision statement, we realize that for our coalition, we like to work collaboratively in Riverside County to eliminate suicide deaths and suicide attempts and increase resources and supports for everyone. So that's just a little bit. I'm going to turn it back over to Diana, who's going to talk about the structure of our coalition.
Thanks, Rebecca. So our coalition that's based on our strategic plan called Building Hope and Resiliency, which you can find on our website, rivcospc.org, is built along the suicidal crisis path. And each along that pathway, we have now built 8 subcommittees that represent the different areas of focus in our strategic plan. So each of these groups focus in on their particular area along that suicidal crisis path and develop various initiatives and activities, all with the goal of eliminating suicide in Riverside County. And all of them meet regularly, some monthly, some quarterly. If you're interested in being a part of any of these groups, all are welcome. And we encourage you to scan that QR code, and you can find the sign-up sheet on the website, as well as historical information about the work that they've been doing, so you can get caught up and find out which group you'd be a great fit for. I mentioned the suicidal crisis path. That's what you see here in the middle of the page. This is what we like to call our Cliff's Notes version of the strategic plan. So this just gives you a little bird's eye view about each of these areas of focus, what they work on. And I won't go into details here, but you can certainly find out more in-depth information in our strategic plan, which you can find on the website. And so next, I want to actually introduce one of our co-chairs for our Measuring and Sharing Outcomes Subcommittee, Crystal Corzine, who is also with our RUHS Public Health Department. And as co-chair, she is now going to share with you all some important data as it relates to today's presentation. So Crystal, I'll turn the floor to you.
Thank you, Diana. Hi, everyone. Good morning. Let me just get my screen up for you all. Okay. Let's see here. Can everyone see my screen? Looks good on my end. Okay. So again, good morning, everyone. My name is Crystal Corzine, and I serve as a co-chair of the Measuring and Sharing Outcomes Subcommittee, as Diana just mentioned, within our Riverside County Suicide Prevention Coalition. And today I will be presenting local data to provide a snapshot of suicide trends within the Black African American community here in Riverside County. This information is intended to help ground our conversation in the current realities and highlight the importance of culturally responsive approaches in prevention. Following this overview, we'll hear from our featured speaker, Dr. Jasmine Brooks Stevens, who will further expand on the lived experiences and community-informed strategies that can support this work. So thank you for having me here today. So before we dive into the data, I'd like to briefly go over a few important disclaimers. These help provide context for interpreting the data, especially when working with small numbers, provisional sources, and known reporting limitations. So the data presented today come from two main sources: the Death Registry for suicide death data, and Essence Emergency Department ED data for non-fatal self-harm injuries, which is also known as suicide attempts. And starting with the death registry, the CDC notes that race and Hispanic origin data may be inconsistently reported, as these are often based on coroner or funeral home documentation. Additionally, age-adjusted rates may be unstable with when counts are low and when analyzing a single year of data, as we will be looking at 2023 data. And then moving on to our emergency department ED data, the 2023 non-fatal self-harm injury data are provisional, since Essence is a near real-time system that doesn't include final billing data. So also our ED data only represent 94% of hospitals in Riverside County. We're still finalizing data sharing with that 17th hospital. Finally, similar to the death data, low counts in ED visits can make age-adjusted rates less stable. Please interpret wide confidence intervals with caution, as they indicate greater variability in the estimates. Thank you. So now diving into the data. This slide shows trends in suicide death rates by race and ethnicity. Let me see if I can move this a little bit so you can see it. Okay. From 2018 to 2022. One notable point is the sharp increase in suicide deaths among Black African American individuals in 2020. Rates were 3 times higher than in 2019, followed by a return to pre-pandemic levels by 2022. Historically, suicide rates have been consistently higher among Asian, Hispanic, and white populations compared to the Black community. But keep in mind, this graph does not break down data by age group, which can reveal very different patterns. We'll take a closer look at those age-specific trends in the upcoming slides. Shifting trends in suicide rates, Riverside and national comparison for 2023. So in 2023, Black African American suicide death rates in Riverside County remain lower than the national average, 5.2 versus 9.1 rate per 100,000 population. More recently, rates now exceed those of Hispanic and Asian populations locally, marking a shift from historical trends. So this is an important trend to highlight, um, as we just mentioned that the Black community has had some of the lowest suicide rates, both nationally and here in Riverside County. But what we're seeing now is that notable shift with Black suicide rates still being lower than the national average are now higher than those of Hispanic and Asian populations. So this shift, what does it signal? A concerning change and emphasizes the need for more culturally responsive prevention strategies, along with deeper exploration into the underlying drivers of these disparities. Exploring gender and method disparities in suicide deaths for 2023. So because the number of suicide deaths in 2023 was small, especially when broken down by race, we focus on the top 4 methods overall, which were firearm, suffocation, falling, and poisoning. And falling here is used here as a respectful alternative for the method terminology. Although we couldn't provide the full racial breakdown this time, we remain committed to sharing these insights as data becomes available. With that said, preliminary data shows that Black African American individuals followed similar patterns for 3 of the 4 main methods: firearm, suffocation, and falling. Poisoning did not appear in the death data for this group, so we couldn't make a full comparison at this time. We also continue to see gender differences overall. Males most often use firearms, while females more commonly use poisoning. Among Black individuals, the top 3 methods reflected this broader trend, and with males more likely to use firearms. So age and method patterns in suicide deaths, 2023. So you'll notice some overlap with the gender and method trends we discussed earlier. And again, here, data reflects a small number of cases, so you'll only see the top 4 methods, as we mentioned: firearm, suffocation, falling, poisoning. And with that said, among youth ages 10 to 18, suffocation was the leading method. Among adults ages 45 to 64 and 65 plus, firearms were primarily means used. So even so, because suicide deaths remain relatively low within the Black African American population, again, we're not able to break this down by race. But even so, the patterns that we see by age group still offer important insights, noting the shift from suffocation among youth to firearm use among older adults. So and another side note here, among individuals ages 25 to 44 in Riverside County, 46% of suicide deaths involve suffocation, making it the most common method for this age group. While we can't fully stratify again this chart by race due to the small numbers, preliminary 2023 data suggests that this pattern is also presented among our Black African American individuals in that age group, where suffocation appears slightly more common than any other method. And this alignment may point to emerging trends that warrant further exploration in the future data cycles, especially when developing culturally and age-appropriate prevention strategies. So here, trends in non-fatal self-harm injury emergency department ED visit rates by race ethnicity for 2018 to 2022. So while suicide death rates are rising among Black and African American individuals compared to Hispanic and Asian populations locally. Non-fatal self-harm injury age-adjusted ED visit rates have historically been higher among our Black African American individuals compared to other racial and ethnic groups with more stable trends. And that is that orange bar that you see in the chart in front of you. Non-fatal self-harm injury emergency department ED visit rates by race ethnicity for 2023. So in 2023, our Black African American population was the second most impacted group by non-fatal self-harm injuries in Riverside County, based on age-adjusted emergency department visit rates. While national ED data does not currently provide age-adjusted rates stratified by race, as you see here, crude national trends from CDC Epicenter suggest that Black African American community is among the most impacted groups, typically ranking the highest or second highest for self-harm related ED visits. So while not directly comparable, the local patterns we're seeing align with national concern and reinforce the need for prevention strategies and that reflect community values. Exploring gender and method disparities and non-fatal self-harm injury emergency department ED visit among Black African American individuals for 2023. So due to data availability and trends, this analysis focuses exclusively on gender and method disparities among our Black African American individuals experiencing the non-fatal self-harm injuries. As you review this chart, you'll notice that Black African American males have a higher proportion of self-harm injuries involving sharp objects. We use the term sharp object here as a respectful alternative, similar to how falling was described as a method in an earlier slide. In contrast, Black African American females have a higher proportion of self-harm injuries resulting from poisoning. Age and method patterns in non-fatal self-harm injury emergency department ED visits for 2023. The top three methods of the non-fatal self-harm were sharp object use, poisoning, and suffocation. Poisoning accounted for a high proportion of self-harm injuries across all age groups. And these bullets summarize the overall population trends. Although the number for, again, Black African American individuals are smaller, preliminary findings suggest that poisoning is the leading method of non-fatal self-harm among those aged 5 to 64. For individuals aged 65 and older, suffocation appears to be the most common method. Trends involving sharp objects are consistent between the Black African American population and the general population that you see on the slide. So where can you find more of these wonderful data insights like these? You can submit a data request through our RUHS Public Health Epidemiology and Program Evaluation branch. Behavioral health and public health work together through the Riverside County Suicide Prevention Coalition, also known as the SPC. When filling out your request, selecting suicide under the type of data needed question helps us ensure you receive unified data and messaging from our coalition. If you have additional questions, you're welcome to reach out to the Measuring and Sharing Outcomes Subcommittee. At this time, I'll hand it back to Diana Gutierrez for the next part of the agenda. And thank you again for allowing me to share these local data insights with all of you.
Terrific. Thank you, Crystal, so much. All right. Does anybody have any comments or questions for Crystal? All right. Well, then, without further ado, it is my honor to introduce our guest speaker today, which is Dr. Jasmine Brooks Stevens, who is an incoming assistant professor of psychology at the University of California, Berkeley. She earned her PhD in clinical psychology at the University of Houston and completed her predoctoral clinical internship and postdoctoral fellowship at Harvard Medical School. In 2025, she was named to the Forbes 30 Under 30 list in healthcare, recognizing her contributions to mental health research and advocacy for underserved communities. Dr. Brooks Stevens has authored over 30 peer-reviewed publications investigating the social and contextual risk and protective factors that shape mental health and suicide risk in Black
I'm
communities.
sorry, this is the interpreter. If you could slow your paces just a little, thank
Okay.
you.
Sorry about that. Grounded in strengths-based approaches, the ultimate goal of her research is to develop culturally responsive interventions, programs, and policies that address racism-related stress, reduce suicide risk, and promote health equity within Black communities. Her work has been supported by several national organizations, including the Ford Foundation, American Psychological Foundation, American Psychological Association, and PEO Foundation. So please join me in welcoming Dr. Jasmine Brooks Stevens.
Thank you so much for that introduction. And thank you, Crystal, for going over some of those really important statistics from Riverside County. I will share my screen now. Give me 1 second. Okay. So I'm looking forward to leading this informative talk with you all today on addressing Black youth suicide, a call for strength-based interventions. I know from that poll we had earlier that we have a few folks targeted towards adults and older adult populations as well. Hopefully this talk will still be informative. As Diana highlighted, this is a very lifespan approach, so a lot of the risk factors that I will talk about is towards youth, but it's certainly applicable across the life course. So thank you all so much for having me. Okay. I do not have any funding or sorry, any conflicts of interest to disclose. And these are some of the organizations that have funded my research. A lot of them were just highlighted. So yeah, thanks so much. Okay, bringing us to the learning objective. So hopefully by the end of today's talk, you all will be able to identify unique social, cultural, and systemic risk factors influencing suicide in the Black community, as well as how we can apply strengths-based interventions to address the unique needs and experiences of Black individuals to, again, address suicide in this community. This is a brief agenda of what we will be talking about today. So I will start off by discussing an overview of how suicide, particularly amongst Black youth, is a public health crisis. We'll then move into suicide prevention amongst Black youth, reviewing risk factors, but really highlighting strength and protective factors that we can, again, use to address Black youth suicide. I'll then go over some culturally responsive clinical intervention strategies, as well as methodological considerations in research, and concluding with how we can bring this all together into bridging research to practice and translating that into real-world change. Okay. All right, so again, beginning with Black youth suicide and how this is a public health crisis. So this quote here really highlights to me the paradox of Black suicide, how African American suicide rates have traditionally been lower than white suicide rates despite a legacy of racial discrimination, persistent poverty, social isolation, and a lack of community resources. So this was highlighted a little bit, right, with what Crystal was sharing with all of us, that how can this be possible? And this will hopefully be some of what we talk about and what you all learn today. When we're looking at older qualitative research studies, this was done in the early 90s, as you can see here. This was a quote from one of the participants that said, as a rule, Blacks don't kill themselves. You should know this already. Well, being Black, you should know that Black people want to live. You should know that suicide is something that occurs over there on the other side of the tracks. We want to live, son. We want to get there. You should know this. This is what a father said that he told his son who was expressing suicidal thoughts. It's incredible how this message has persisted across generations that Black people don't kill themselves, that it happens over there. This dismissal is one of the main things that we will discuss the importance of addressing. Another quote from a Black adult said, the suicide rate being so low among Blacks goes back to the strength that we have as a culture. We have always been aware of what our strengths are. Our strengths have overpowered our weaknesses, in a sense, allowing the bullets to bounce off. The bullets hurt, but we've been taught to stand strong. As we'll see from today, this is not the case, right? They don't bounce off. This is no longer a white thing, right? And we're seeing this from so many statistics today. So this picture here highlights a Ring the Alarm Crisis of Black Youth Suicide in America report that was released in 2019 from the Congressional Black Caucus, highlighting once again that suicide amongst Black youth is a national crisis. We're seeing news articles, young Black men are dying by suicide at alarming rates. Suicide among Black girls is a mental health crisis hiding in plain sight. And then once again in 2023, after that peak that again Crystal highlighted during the pandemic, we're still seeing this still ringing the alarm, an enduring call for action on Black youth suicide prevention. A lot of the reasons this is the case is if you look at this chart here of suicide deaths among Black youth, we are actually seeing that the suicide rate rose 144% among Black individuals ages 10 to 19 over this time frame. I mean, that is just so alarming, 144%. We see here another chart. If you look at the arrows here, we're seeing that this looked at past year prevalence of suicide attempts amongst US adults. And we're seeing that the second highest group here is Black or African Americans for, again, past year suicide attempts, just behind multiracial, but higher than white adults. We're seeing that this is particularly a problem amongst the younger adult communities, but overall, this chart shows that it actually is, suicide is now surpassing rates in Black individuals as compared to white individuals. Suicide amongst Black children and young adults is increasing faster as compared to any other racial or ethnic group. I just highlighted, right, that the suicide rate has increased 144%. But even more importantly, Black children 5 to 12 years old are actually twice as likely to die by suicide as compared to white peers. So while historically this has been seen as a concern that doesn't necessarily impact Black communities to the same extent, we are really seeing that this is changing. When we look at gender differences, we see that Black adolescent females are more likely to attempt suicide as compared to adolescent females of other racial or ethnic groups. And suicide rates for Black girls ages 13 to 19 has increased 182% over the past 2 decades. I mean, 182%. I'll repeat that again because that is just so unbelievably alarming, right? Between 1991 to 2017, we see that injury by attempt, so actually, again, how lethal the attempt is, has increased 122% for adolescent Black males. And just one more statistic to really call to us this attention that it is no longer just a quote unquote white thing that again, bullets bounce off of Black people is this chart here, which shows that rates surpassed white peers for Black adolescents in 2022. Some quotes that I think is important to contextualize us today, right? When we're looking at current events and recent news events, right? It's an idea that in one form or another has been repeated again and again. Chesley Christ had so much. She seemed so happy. She didn't fit the mold of someone who dies by suicide. For those who do not know, Chesley Christ was, I believe, I'm trying to remember exactly if she was Miss America or someone in a certain state, but she won several beauty pageants. She was beautiful, seemed to again have it all, and died by suicide. And so this is a particularly important quote of just like, what is the mold? We don't know, right? I've been searching my brain thinking, what did I miss? What did I not see? Right? Someone, CBS This Morning host Gail King, who was a mentor and friend to Chesley Christ, told Time, recalling a final conversation that the two shared in December, how could I miss the signs? There were no signs. That's the truth. Another important thing to highlight is we so often look for warning signs when oftentimes for Black communities, they look very different or potentially aren't there. For those who know Twitch, Twitch was a famous dancer, and So You Think You Can Dance, and also I believe, DJ, but it was part of Ellen DeGeneres' show, and also recently died by suicide. So this here shows that I was a fan of Twitch, and So You Think You Can Dance, and I can't help but to wonder if the people who sometimes are the presumably happiest on the outside are the ones who are trying to create something that they want for themselves. An interesting perspective to consider as well, right? That even though we may exude happiness to other people, maybe that's an act that you're trying to portray for yourself. Okay. So with that context in mind, we will switch now to discussing suicide prevention within the Black community. So this slide here highlights some broader youth risk factors that have been identified in the literature, right? So past suicide attempts, hopelessness, mental health disorders, substance use, impulsivity, availability of means, particularly in this generation with increased access to guns and more lethal means. As well as family history of mental illness. So again, these are some of the more traditional risk factors that I'm sure many of us are familiar with. We also have in this generation and or in more recent generations, right, the power of social media and online forms of discrimination, right? So cyberbullying, online profanity, hate speech, as well as online self-harm and violence messaging. This is certainly something that literature is pointing to as a reason for the increase in suicide rates is just the amount of knowledge that is now shared across these platforms that can potentially increase risk. When we get to my research program, as we transition now, is looking at those more culturally relevant and beginning here with risk factors. And so if you look at this slide here, this highlights a little bit of the research that I have done on risk factors for suicide in Black communities. That first study there really focused on how discrimination is linked to the capability for suicide, which is specifically proposed to be what differentiates people from thinking about suicide and actually dying by suicide. So discrimination was shown to be linked to capability for suicide for Black adults, but not white adults. Okay. Also, we see anxiety sensitivity, one's overall physical and cognitive symptoms that relate to anxiety is linked to increased suicide ideation, as well as impulsivity. Recent co-authored work looked at bully victimization, dating violence, and depressive symptoms, on how that's also linked to suicidality for Black youth. My dissertation, which I will talk a little bit more about today, looked at how the COVID-19 and racial discrimination syndemic, so this overlapping multiple epidemics, how that impacted suicide risk, as well as work that I've done on gun violence exposure and racial trauma. And so those are some of the citations there. Happy to accept some questions. I will just go over a few that focus again on youth and young adults here. So, highlighting and moving into this discussion of what are culturally relevant risk factors that we need to consider and evaluate, in addition to those more traditional risk factors, certainly at the top of the list is racism and racial discrimination, right? Racism is a system that assigns value and determines opportunity based on the color of one's skin. It has been declared a public health crisis in America that, of course, has been around since before the origins of our nation, right? Today, even 92% of Black Americans still report experiencing racial discrimination at some point in their lifetime. And when we look at adolescents, we actually see that a recent national study showed that racial discrimination occurs up to 5 times per day on average for Black adolescents. This is, of course, linked to numerous adverse physical and mental health outcomes, including suicidality. So that brings me to the discussion of, as I mentioned earlier, my dissertation, which looked at COVID-19 and racial discrimination and how it's essentially a new chapter to an old story, right? How again, racism has been prevalent for so many generations, but now we inserted this overlapping pandemic that disproportionately impacted Black communities. We saw that Black Americans had the highest COVID-19 hospitalization and mortality rate, as well as, again, combining this with increased media coverage of discrimination, police brutality, increased pressure to participate in Black Lives Matter movements, coupled all of these disproportionate death rates. And so this is what was proposed to be a syndemic or concurrent epidemics for Black communities. Looking at these results here, we saw that initially COVID stress actually did not significantly predict suicide risk for Black young adults. This was proposed to be because this data was collected in 2022-ish, so a little bit after that peak. And we know that that COVID-19 didn't necessarily impact young adults as significantly as it did for older adult populations. So that was potentially an explanation there. However, racial discrimination was significantly associated with suicide risk. This was measured by looking at microaggressions, as well as trauma symptoms of discrimination and perceived daily discrimination. And then lastly, looking at the overlap of these factors, so COVID stress and racial discrimination, we did see that this overlapped to significantly impact suicide risk. So although COVID stress wasn't initially associated with suicide risk, we did see that once we looked at the overlap, there was a significant effect here on increased suicide risk. This chart here describes that interaction a little bit further. So if you look at that red square in the top right corner, you actually see that for individuals with higher levels of racial discrimination and higher levels of COVID stress, those were the individuals at the greatest risk for suicide, thus demonstrating that syndemic proposal that we discussed, that the individuals that are at the heightened risk for suicide are folks that are reporting higher COVID stress as well as higher discrimination. We also see, again, that policing and gun violence exposure is a very important risk factor to consider as Black youth experience disproportionate contact with the police. Police-related deaths have even been shown to influence the biological functioning of Black boys. Specifically, this study here highlighted found that on average, elevated nightly cortisol levels, so again, a stress indicator, increased by 46% for Black boys who were exposed to a police-related death of a Black victim in the last 30 days. So cortisol levels, again, increased by nearly 50% for Black boys who were exposed to someone who died due to police violence. We actually saw that in a recent study, suicides amongst Black youth increased by about 1 count nationally within 3 months following police killings of Black unarmed persons. This equated to about 5% of total Black youth suicides from 2013 to 2019, found again due to witnessing a police killing of an unarmed Black person. Racial trauma or race-based traumatic stress is another important factor to evaluate and consider. And this is specifically the emotional and psychological response to racial instances that are unexpected, experience as threatening, and result in significant psychological distress. Why racial trauma is different from PTSD is that it accounts for chronic and cumulative exposures, right? We went over some of those statistics of how frequent discrimination is. So it's not necessarily a criterion A event, but it is chronic and cumulative. Symptoms of racism-related trauma do, however, considerably overlap with post-traumatic stress symptoms. That includes mood alterations, re-experiencing the event, rumination, and avoidance. One of my recent papers looked at how racial trauma impacts the mental health of Black young adults, specifically anxiety, depression, and suicide ideation. And we saw here that racial trauma is linked to resulting anxiety, depression, and suicide ideation for Black young adults. Additional risk factors that are important to consider is neighborhood disinvestment and violence, right? So many Black youth and Black young adults and communities live in long-standing poverty, right? I mean, fewer resources, limited opportunities, higher exposure to violence, right? These can contribute to chronic stress and hopelessness, which of course is then linked to elevated suicide risk. We also need to be mindful of cultural mistrust and mental health stigma, right? So historical and ongoing harms by medical and mental health symptoms have created a deep mistrust in Black communities. This is coupled with stigma around mental health, some of those quotes that I had described to you earlier, that it's just, we're okay, right? That message is still pervasive in so many Black communities today. Also need to consider, right, barriers to care, socioeconomic inequities, right? So often lacking culture, like providers are often lacking cultural competence, right? And when it comes to accurately identifying symptoms in these populations of color. Another factor that I think is important to consider is adultification, right? So when you think about Black youth, especially girls and boys, how often are they perceived as older, less innocent, more culpable, more violent, more aggressive, right? This can contribute to over-policing, harsher school discipline, and less emotional support, which also further isolates them in times of distress. We also need to consider intersectionality, right? And gendered stressors. I described to you all a lot of differences in gender rates for suicide, as well as we didn't necessarily go over it, but I believe Crystal highlighted as well how means differs across genders. Right. And so that highlights that we need to consider how gendered stereotypes of the strong Black woman, or again, how potentially homophobia and LGBTQ communities may impact their overall levels of or desire to live, right? Family environment as well, specifically how supportive are family members around talking about these concerns? What are the stressors going on for family members? When we think about all of the stressors in the pandemic, especially, but following around working from home, losing jobs, right? Unemployment from family members, those all impact the youth as well. But this brings me to, right, if we are hoping to create a world where Black youth no longer desire to die, we need to give Black youth a reason to live, right? This is where the strengths-based factors and the transition comes in here. So I'm going to highlight for you all a few theoretical frameworks that grounds a lot of the work that I do that I think, again, is very important when we think about what factors do we need to consider when we talk about strengths-based interventions. So this first theory here is the psychology of radical healing. And so critical consciousness is the root of this theory, which is specifically one's ability to reflect on the socio-political reality at question, right? And want to resist that oppression. So especially in today's society, right? When we look at what the socio-political reality is for so many people of color, how then do you feel a sense of agency in that? Do you feel it at all? How do we resist this level of oppression? That is critical consciousness. Cultural authenticity and self-knowledge, right, refers to just how ingrained are you in your roots and ancestry, right? Like, what does race mean to you? What does your ethnicity mean to you? And how salient is that pride in your culture? Strength and resistance, right? Your ability to commit to living joy-filled lives despite all of this trauma and oppression that is going on in your community. Emotional and social support through collectivism, right? So specifically community support, familial support, is emotional and social support existing? As well as radical hope. This is a newer construct, but it's specifically not just hope for a better future, but specifically for positive social change, for racial equity. That is what goes into radical hope. And so these factors here is what's proposed to be some of the most important factors for promoting radical healing. We also look at this theory here, racial, ethnic, and cultural resilience factors for Black youth. And they highlight a lot of the same principles, ethnic and racial identity. So that significance and meaning of your race and ethnicity. Ethnic racial socialization, another really important factor to assess is how is that individual learning what their race or ethnicity means? Are they learning mostly barriers, or are you learning a balance of pride as well? Religiosity and spirituality, as well as, again, parenting and family, and how these are important contexts for especially youth development. And this last theory I will highlight for you all is the Hearts framework. So you see a lot of similar themes. Once again, critical consciousness, right? Collective memory is a new component here, which refers to a group's shared understanding of the recent and more distant past, right? It can aid in the healing process by actually discussing what are these lived experiences? What is my collective memory of what it means to be Black in this country, right? That is important to consider. If that is flooded with negativity, that's going to, again, foster a sense of hopelessness, right? Connectedness, same thing as emotional and social support. And as you see, connecting those dots there is justice, which is that same idea of, right, equity, racial equity, promoting, again, where everyone is actually not viewed differently based on their skin color. But at the root of that, you see storytelling and resistance. And I think that's important to highlight here because I'll talk about that a little bit more today. But looking at how can we recreate narratives, right? So often Black youth and Black communities have one narrative. This is where the men go. They go to incarceration, selling drugs, not graduating school. When are we going to break that cycle? How do we, when so many community members, that's what they're told. It's just that one narrative. And it's not true, right? And so, how do we engage with our clients around storytelling and narrative work to be able to redefine that narrative and see, no, that's not where you have to end up? That's another important component. Looking at some of my work here and the strengths-based factors that I have identified, some of which I'll go over a little bit more with you all today, is self-acceptance. Mindfulness, right? One's ability to stay in the present moment despite all of what's going on. Critical consciousness, as I've highlighted a little bit for you all already today, as well as psychological flexibility. And I'll go a little bit more in detail on what that means in a little bit. Also, hope, again, and mindfulness. And a recent under review paper showed that ancestral strength, faith, community support, therapy, and values-based action were actually all sources of coping and resilience for Black adults during the pandemic. Going a little bit more into some of those studies here, in my dissertation, in addition to looking at this endemic of COVID-19 and racial discrimination, I examined a model of radical healing. Can those proponents that I discussed to you all have an effect on reducing that pathway from COVID-related stress and racial discrimination to suicide risk? So if you look at this chart here, this was the first finding, which actually showed that critical consciousness had a protective effect on the association between discrimination and suicide risk. So if you look at that red box again in the top right corner, you see that the individuals who had the highest level of suicide risk were those who had higher exposures to racial discrimination, but low levels of critical consciousness. So again, that low lower levels of ability to make a difference and resist oppression. So they're experiencing high levels of discrimination, but they're missing that sense of agency. That was associated with increased risk for suicide. If we look here, racial identity also moderated the association between COVID stress and suicide risk. But this finding was very interesting because it was actually in the opposite way that we expected. So if you look at that red box, you see that individuals at the highest risk for suicide were those who reported higher levels of COVID stress, but higher levels of racial identity. Why is that the case? Because there's so many other factors that we need to consider. And when we think about how, when for someone who has a more salient racial identity, maybe they're more likely to interpret events as discriminatory. Maybe these individuals have been socialized in a way to be more aware of barriers, right? We don't know because that's an additional next step, right? But that shows that there's so much more that we need to give Black young adults in this case who have a higher racial identity to be able to resist levels of oppression. So I mentioned earlier, another one of my papers looked at psychological flexibility. What is that, right? So specifically, it is a core component of ACT, acceptance and commitment-based therapy, and it is perceived as the ability to accept aversive experiences, but still engage in values-based action. And so when you're faced with a distressing situation, how do you still respond in a way that is aligned with your values, as opposed to, for example, turning to substances, aggression, or other forms, right? Like, how do you still align your behaviors in a way that supports your values? We saw that that actually helped to explain that association between racial trauma and mental health that I mentioned earlier to you. So while racial trauma was associated with anxiety, depression, and suicide ideation, we found that for individuals with higher levels of psychological flexibility, this association actually was less prominent. And so specifically what this found was that low levels of psychological flexibility explained a lot of the associations between racial trauma and these mental health outcomes, which really points to how psychological flexibility can be a very important treatment target. So again, how do we get individuals to behave in a way that aligns with their values? How that can be, again, really potentially useful in reducing risk for mental health and suicide. I think I've gotten down that you guys switch every 15 minutes, so giving you a second there. All right, so self-acceptance, another factor that I have examined in my work, that is another important treatment target for reducing risk for suicide. So unconditional acceptance of oneself, right? Core component of the model of psychological well-being, and it is influential in how we interpret when mistakes occur or when rejection occurs, right? Like, do we still accept ourselves and our self-worth? That is shown to influence mental health outcomes. Specifically, in one of my papers here that I'm highlighting, we look here, we saw that there was a extremely significant moderation of self-acceptance on the pathway between depression and suicide ideation. So much so that for individuals in that blue line there with high self-acceptance, depression was no longer associated with suicide ideation. One of the strongest predictors for suicidality was no longer associated with suicide ideation for Black young adults who had high levels of self-acceptance. So then the question, million-dollar question becomes, how do we promote self-acceptance in a world that's producing so many distressing messages? That will be important now as we transition to culturally responsive intervention tools. So many of you all may be familiar with this, but the addressing framework is a really useful clinical intervention tool to use in the intake assessment, right? So specifically, it goes over these components here, why it's important to assess not only where they fall within these categories, but do they come from a majority or minority group, right? So age and generational influences, being mindful that adults are the majority group. For developmental disabilities or disabilities acquired later in life, right? Being mindful and evaluating this as well as religion and spiritual orientation, being mindful that in America, Christians are given more power oftentimes. Ethnic and racial identity and socioeconomic status, additionally, as well, two and factors to consider, as well as the need to look at sexual orientation, indigenous heritage, national origin, as well as gender. And so this is a really good framework for, again, what aspects of someone's identity do I ask about in an intake assessment? How do I get that more culturally rounded and holistic perspective of the person in front of me? The Jones Intentional Multicultural Interview Schedule is a really good way to operationalize, in my opinion, the addressing framework. And I'll show you a picture on the next slide that goes over it a little bit more, but it can be used to structure some of those initial therapeutic sessions. It is based on the addressing framework, as I just mentioned. And it can be really helpful for how do I ask about these various components of someone's identity, especially if I am of a different or majority group. So this is just one picture here. It actually breaks down every component of what I mentioned in the addressing framework. But just to highlight one example for you all here, if you look at age, right, it again highlights who are the minority perceived groups. And then it gives you sample questions. So this is one of my number one questions, like I said, that I often get is how do I ask about these components of someone's identity, especially if I am from a different group? So these are ways, instead of saying, right, like, just how old are you? Instead of asking these more close-ended questions, I mean, how do you define family? Who is in your family? What do your family members call you? Right? Like these are ways to understand generation and age instead of just how old are we? Okay, so I really love this interview schedule for, again, giving you ideas of how to ask about some of these components of someone's identity. Looking again at just to highlight the religion spirituality one, because I think that also is a good example of not just what is your religion, right? But how does your family deal with feelings? That could be a more creative way to get at, do we turn to religiosity, right? What are some coping strategies? How does religion and spirituality impact your family, if at all? All right. More, again, specific examples there. To give you all some more concrete as well, tools when working with Black clients, it is very important to routinely reflect on your clinical decision making, reflect on our biases that we may be bringing to the table, reflect on any identities that we may hold that are privileged, and then how that can impact the therapeutic relationship. Making sure to affirm our clients' racial identity and lived experiences, right? Explore heritage, explore narratives, and explore cultural pride. But affirming someone's racial identity and understanding that that may be needed as part of the validation process. Using strengths-based approaches, right? So shifting away from that deficit-based diagnosis approach where we're just like, what's the problem? How do I fix the problem? How do I diagnose the problem? But what can I also boost, right? Like, what are these protective factors that are also missing from the conversation? How can I highlight resistance, cultural strengths, and empowerment? And incorporate some of these storytelling or expressive writing and narrative therapy techniques. One of the more go-to strategies that I like is bridging off of that tree of life exercise, right? So, what are your roots? What is your trunk? What are those core values? That can be a creative way instead of just like, tell me your values, right? Using exercises like this could be much more helpful than just measures or batteries or more close-ended questions, right? So again, it goes into roots, your trunk, your branches, surrounding, right? Like that could be a really good way of understanding how does that individual conceptualize themselves and what's important to them. Also, consider historical and systemic trauma. How can racial discrimination contribute to maybe hypervigilance, anxiety, or depression amongst our Black patients? How can we, again, evaluate some protective factors? As well as exploring the role of therapy beyond the individual, right? So that picture on the screen here, I love this resource. It's led by the Association of Black Psychologists, and it's called the Sawubona Healing Circles. And so it's specifically led by Black psychologists, but it's meant to be a healing circle to discuss what are we going through today and how can we come together as a community to support each other. And this is ongoing. It happens, I believe, monthly, but a great resource as well for your clients to consider across the life course. So again, the importance of incorporating maybe less traditional individualistic approaches and support, and how can we bring the community and family into therapy? Also, very important and a useful tool is somatic and body-based approaches. So that non-judgmental acceptance of where I am when I can't change or reframe this reality that I am living in. How can I then accept what is out of my control, but still commit to that action that enriches my life, right? That's that psychological flexibility, cognitive diffusion that we talked about, but really highlighting why acceptance and commitment-based principles, as well as body-based approaches of mindfulness, meditation, and movement can be really helpful in promoting this. When again, I can't change the reality, how can I come back into my body? That is what I have control over, right? Those can be really important tools as well. Also, when we think about racial socialization, Aisha Metzger and a few of her colleagues recently came up with a manual that integrates racial socialization into trauma-focused cognitive behavioral therapy, into again, a manual for how to talk about racial socialization. So, how to address intergenerational and racial trauma as a core therapeutic focus through these trauma-informed approaches. So, another wonderful resource to consider when you're wondering, how do I unpack how someone thinks about race or how their family has talked about race to them? Great resource here for doing that. Now moving into methodological considerations in research. It is very important that we integrate lived experience, right? So qualitative, mixed methods approaches. I'm not sure if you all would believe me, but to date, there has been five studies that have used qualitative methods to look at Black youth suicide. Major concern when we think about some of the limitations that exist from quantitative measures, right, that are often binary, don't often consider these factors that I've highlighted for you all today. So really, we need to turn to the community. And when we also think about how clearly what we're doing isn't working, I told you that suicide rates are increasing at unprecedented levels for Black communities. So again, our approaches aren't working. How do we fix that? We need to go to the voices of Black youth themselves to understand what are the things that you all are experiencing that we as researchers, as clinicians, as providers and supporters are missing. This elevates firsthand narratives to ensure that, again, our research and practice are grounded in reality, not assumptions. We're centering the voices of those most impacted and integrating them into decision-making and intervention development. So really, again, highlighting the importance of qualitative mixed methods approaches here. Also, community-based participatory action research. So for those unfamiliar, that chart kind of highlights a little bit of the components here, but it's really this collaborative and equitable approach to research that is carried out in partnership between researchers and community members. So for example, right, like how would I, as someone who wants to lead this research, partner with an organization like Riverside, right, Suicide Prevention Coalition, to understand from their perspective, what are you seeing in the community that's missing? I'm not going to come in here and say, as a researcher, XYZ associations exist, but how can we do this together? How can we work together to form this partnership, assess community strengths, dynamics, and priorities, and co-design a research project together that is informed by research, but also informed by community and practice, right? It will involve iterative processes that loop in feedback and interpretation of findings, as well as a key component of CBPR is how do we translate these findings into the community? How do we disseminate these findings so that it doesn't just stay here, right? As well as, again, routine evaluation of our approaches. Another technique that I really think we need to incorporate more is youth advisory boards. it provides a platform for youth to contribute to the design and implementation of research. And it essentially involves whenever we're leading a research project, a design, an intervention. I mean, how can we pilot this with including youth advisory boards? So before we get to implementation, we're hearing the voices of youth, or again, this could be again across the life course, right? But individuals who have experienced, in this case, suicidality, to help define our mission and goals, to help design the structure of whatever event or intervention we are implementing, as well as identifying required resources and establishing, again, operating procedures all together. Okay, oops. And then this last part that I'm going to highlight for you all today is how do we take everything that I've talked about and bridge research to practice? So to date, this tool on the screen here, or sorry, yes, the tool that's listed here on the screen is the only culturally adapted tool for measuring suicidality that exists today. It is the Cultural Assessment of Risk for Suicide Measure, and it captures factors associated with suicide for individuals of color, specifically, again, cultural values on the acceptability of suicide is what's known as cultural sanctions, so cultural sanctions of suicide. It assesses one's verbal and nonverbal expressions of suicidal thoughts and behaviors, so idioms of distress is, again, those verbal and nonverbal expressions of suicidality. Minority stress may refer to, again, those social identity stressors, including discrimination and racial trauma, as well as social discord and any alienation that may occur due to these minoritized and marginalized identities. So this is a tool that incorporates questions around, again, these more culturally relevant risk factors. It has recently been validated amongst Black adolescents as of, I believe, a month or two ago. So again, this is very emerging research. Clearly more is needed, but I did want to highlight that the CARS is a very useful tool for assessing suicide in communities of color. A recent meta-analysis and systematic review that actually is in press. So I'm going to highlight a few that they talked about here of useful interventions for reducing suicidal thoughts and behaviors amongst Black youth. So this first one here was an adapted coping with stress intervention. And some of the components that were really useful here that you all can take and apply to, again, various interventions that you all are leading is modifying names and metaphors to reflect Black culture, right? Adapting the intervention to include experiences within the Black community. So in particular, this intervention used examples of racism, police violence, police brutality, violence, and poverty. And it incorporated providing cultural competency training, right, to enhance facilitator sensitization to socioeconomic, racial, and cultural issues. So all really important components that you all can take to leading culturally mindful interventions. All right. Another one here that they highlighted was attachment-based family therapy. And that also was shown to be helpful in reducing suicidal thoughts and behaviors for Black youth, specifically the components around strengthening parent and adolescent bonds, which makes sense when we think about how, again, those messaging that it can occur that demeans what's going on can be so pervasive and impact so much, right, Black youth suicidality. So how can we strengthen those bonds? And how can we, again, they adapt discussions to include talking about racism and discrimination and how we can cope with these experiences. So when you think about cope ahead, right? I mean, those components there were particularly useful in reducing suicidal thoughts and behaviors amongst Black youth. I believe they also, now that I think about it, they also had that cultural competency training component. So once again, highlighting there the need to provide that as orientation whenever you all are leading these various interventions. And then the third and final intervention strategy that was shown to be adaptive here for specifically Black youth. And I think it's important to highlight that only 13 were evaluated. They looked at research that has ever existed, and they found 13 randomized controlled trials that looked at efficacy of interventions for Black youth. So very limited research that we're highlighting here, but multisystemic therapy was shown to be adaptive, specifically the components around safety planning, how to disengage from deviant peers, how to improve caregiver knowledge on, again, monitoring and strategies to reduce suicide risk, as well as how can we emphasize that more collectivistic socioecological context of children and families. Another important component of this approach here was that it was a home-based delivery model. So it was shown to be really adaptive because it addressed a lot of those barriers to care that we've talked about, because the clinicians actually went into the individuals' homes. And another approach that we're still working on actually showing the validity in Black communities, but I personally really prefer, is the collaborative assessment and management of suicidality framework, and CAMS. And so CAMS is an intervention that has been shown to address thoughts of self-harm and suicide. It really emphasizes the collaboration between clinicians and patients, and therefore is very patient-centered. One of the forms that they use that I want to highlight with you all is the suicide status form. And it really focuses on, again, how do we assess and treatment plan together? How do we identify and treat suicidal drivers? And then how can we collaborate on this outcome and disposition form of, like, where do we want to go, right? So I think there's some adaptation that could be useful that incorporates more of that expressive writing, storytelling component that I mentioned. But I think that overall framework of collaborating, again, between clinicians and patients that we often arguably miss is really highlighted in CAMS. And so in conclusion, where do we go from here? Right? Overall, the traditional medical model focuses on pathologies and risk reduction, right? How do we then transition that to bolstering cultural values and strengths, to identifying protective factors? We must also evaluate and account for relevant developmental mechanisms. And a component that I realize I didn't necessarily have time to talk about today, but I think is so important that we consider, is what do we do for survivors of suicide loss? How do we approach postvention? Also, when I was making this presentation today, I realized just truly how there is little to no research that even exists on survivors of suicide loss, particularly for Black communities. We're so focused, like I said, on risk reduction, which of course matters. But what do we do when it happens? What do we do for those family members who have lost their child, who have lost their sibling, who have lost a parent due to suicide? So another really important next step. When we think about implications of this work, right? Like, really, I hope to advance our understanding of social and contextual risks and protective factors that influence suicide in this community, as well as, again, identifying these protective factors that disrupt the pathway from racism to suicide vulnerability. When you think about practice, I hope that my work really improves suicide risk assessment, prevention, and intervention strategies, as well as gives us tools for how we can incorporate and integrate Black cultural values within our mental health care services. And lastly, certainly, I hope that, again, my work does not stay here. It informs policy development, specifically targeted at the reduction of racism and associated health consequences, and the call for the need for implementation of large-scale Black youth suicide prevention and intervention strategies. This is a list of resources here. I'm happy to come back to this if anyone has questions or wants to take a picture here, but these are particularly useful resources that I incorporate often when I'm working with my youth of color. And yeah, specifically, again, trying to provide resources that are mindful of culture. These are some that I really prefer here. And with that, I want to thank you all so much for having me. And here is my contact information if anyone wants to have any additional discussions. But yeah, happy to accept any questions.
Thank you so much, Dr. Brooke Stevens. That was fabulous. Appreciate that presentation. Questions? Who's got questions or comments? Feel free to unmute, raise your hand, or put it in the chat. Ooh, there's a lot going in the chat. Let's see. I'm going back up to the top, so I'll read some of the things that are in here. So this was a little earlier on in the presentation. Tiffany was asking, I think this was related to some of the data. Are they counting reckless means of death within the Black community, such as through gang violence, car crashes, etc.? I've seen more suicidal behavior that led to accidental death in my family and friends. So I don't know if there's any comment or feedback around that.
Yeah, and specifically, I'm trying to find the comment too, I think.
It's up. It was earlier, like at 9:44. So Tiffany, I don't know
Got
if you
it.
want to
Yes.
clarify that a little bit.
Let me see. Are they counting reckless means of death? No. So this specifically the statistics that I highlighted was looking at what I don't know if it was the government census, CDC, right? But they determined that the death was due to suicide. So not necessarily accidental. I mean, but that is an important point to highlight is how often are deaths in the specifically in this case the Black community mischaracterized, right? So I think absolutely that could be a factor at play here. Mhm.
Some other comments around additional risk factors, self-identification of individuals that belong to the LGBTQ plus community, having higher rates of suicide. Tiffany also notes, along with struggling being seen as a right to the good life because of having to work twice as hard to get half as much. Pain, struggling, high stress is so normalized. We have some thank yous. I enjoyed the deeper understanding of suicide risk factors and how we can incorporate values. This has been helpful and insightful, very rich and incredibly informative. I would add that boys and girls clubs are also very helpful to youth of color. Individuals that work in these programs truly care about the youth and are often seen as mentors. These leaders also detect some risk factors as they gain rapport with and promote education. This often leads students to resources and access a prevention method. Lots more thank yous. And then Andre is asking if your tool is available for use.
So the tools that I presented to you all, none of them are my tools. They're actually, so I'm not sure if you're referring, maybe you could clarify which tool you were referring to. But most of the ones I presented are all available online. So CARS, maybe what you're talking about, that was produced by Joyce Chu. And that is available online. CAMS is an intervention led by David Jobs. That's available online. So yeah, most of the ones I presented today, you all can access online. Mhm.
And we have some requests for the slides. I believe you're going to share a deck with us that we can send out.
Yeah, so I'm going to share an adapted deck with you all, so it won't necessarily go as in depth or maybe be as pretty, but it will cover the specific tools that we talked about today, because I absolutely think it's important that we all have that resource. So yeah.
All right, and more thank yous, that it's an honor that you provided this information. Maybe interest from school counselors on a presentation in school settings.
Absolutely.
Yeah.
Yeah, I think this can be this the purpose of this was hopefully to be adaptive to broad audiences, but absolutely you can narrow in on school counselors and school-based interventions, teacher-based interventions, school counselors, all the things. So yeah, absolutely. Mhm.
Awesome. Leah.
Yes. I was just thinking, you'd mentioned that there wasn't much research done on postvention. And one, do you think that that's associated with this kind of idea that African American families are resilient and they don't really need the family therapy that many other ethnicities are offered? And is it something that you have considered, looking at since it doesn't exist or
Yeah.
much doesn't exist?
Absolutely. Great question. So, one, I think that part of the reason, a large part of the reason that there's limited research in this topic is because there's limited research overall, right? So, if we still can't even address the crisis, that's where the limited attention, in my opinion, is going to go. I think that we also need to be looking at postvention, but I do think that that's a large reason for why there's limited research is because there's few researchers in general looking at this work. I mean, I mentioned there's only been 13 randomized clinical control trials ever that looks at efficacy of interventions for Black Americans, right? So I do think that's a large reason, but you highlighted very important reasons as well that I absolutely think influences why people don't think that asking those questions may be as prioritized is because, yeah, the Black family is resilient, right? Absolutely. I think that that myth is a large reason that we're not seeing that research being done. But it absolutely is something that I'm interested in looking at. It is actually a project that I'm in the process of developing. One of the priorities for the American Foundation of Suicide Prevention is survivors of suicide loss and how we can provide more useful tools for these communities. And so definitely that's an area I'm pursuing with them. But yeah, great question.
Great. Another question in the chat. I'm a QPR instructor with San Diego Coalition. Do you find that tools and methods such as QPR are as impactful on Black youth?
Absolutely. Great question. And that's, I mean, one that it seems, yes, did not make it into my talk, and I'll make a note for that because I think it's very important. I actually have one of my mentees brought QPR to their HBCU and noticed a huge shift in just participation and people wanting to engage in these more I think accessible is what really highlights QPR, right? Is that it's just that it's so accessible and that so many community members can engage in these suicide prevention strategies. So absolutely, I think that is a useful approach as well.
Any other questions or comments for Dr. Brooks Stevens?
If we are interested in Dr. Stevens doing a presentation for our agency, who do we contact?
You can contact me. I'll put my information in the chat again. One second here. There's a contact form on my website where you can shoot me an email. But yeah.
Thank you. Thank you. Appreciate it.
Anyone else? And Dr. Brooks Stevens, you're going to stick around for the rest of our meeting. We do have more content. So if a question comes up, feel free to drop it in the chat. And then after our next presenter, we'll have a little more time for Q&A as well. So if something comes to mind, everyone will be here to be able to respond. So once again, thank you so much, Dr. Brooks Stevens. Fabulous presentation.
Thank you so much for having me.
Yeah, and so moving right along, I want to introduce our cultural liaison here with Riverside University Health Systems Behavioral Health Department, Hazel Lambert, who also serves as a co-chair of our African American Family Wellness Advisory Group, or AFWAG subcommittee, that works closely with our Cultural Competency Unit. And Hazel's going to talk about that group along with some local resources and activities. So please join me in welcoming Hazel Lambert.
Thank you. Thank you. Let me go ahead and get myself set up here. And just to share a little bit about the work that we're doing here with AFWAG. So I am Hazel Lambert. I am the Cultural Community Liaison Consultant for the African American community. I currently serve as the chair for African American Family Wellness Advisory Group, aka AFWAG. So just to give you guys a little bit about our mission, and our mission is to increase the awareness and the seeking of culturally competent mental health services within the Black and African American communities. And we want to do this through education and outreach. And we seek to increase participation and collaborations between providers, practitioners, individuals, community, and faith-based organizations to ensure access to resources needed to thrive. And one of the focus that I always say is we want to do more than just, do the work. We want to make sure that our community is thriving. So what I want to do is just kind of give you guys an overview of some of the work that we're doing. But let me go back just a little bit. Although I serve as the chair for the African American community, I do have a steering committee, and I see that Nisha's here today, and I'm sure she'll be able to advise some additional information on the work that we're doing for this year moving forward. So basically, I wanted to kind of give you guys an overview of some of the things that we've been doing as AFWAG. And I wanted to mention that I'm just one of 9 other community liaisons that are representing our different communities. And my role in representing the African American community, I wanted to kind of give you guys a highlight of some of the things that we've been doing for 2024, and then bring you a little forward to where we are in 2025 right now. So usually what I try to do every year is I try to come up with a theme, and then try to focus that theme on the work that we're doing in the community. So in 2024, our theme was cultivating synergy. The African American Family Wellness Advisory Group Steering Committee concluded that through its community outreach efforts and ongoing dialogue with our different stakeholders, that mental health disparities cannot be tackled by one group alone. And that's where the cultivating synergy came in. As such, we envision that this year's theme was centered on cultivating synergy. Our mission is to ensure that collective efforts from community leaders, our healthcare providers, our faith-based organizations, and family engage in creating sustainable solutions that embody synergy. So one of the things that I wanted to do, especially I heard Dr. Jasmine talking about, oftentimes when we hear about the African American community, we hear kind of a lot of negativity. So one of the things that I wanted to do during our monthly meeting is kind of highlight do some Black history moments, right? To talk about some of the positive things that we're doing in the community and to show the different contributions that African Americans have made, because this is a part of our mental wellness, right? I wanted to look at, how we are so involved politically, socially, economically, also with our science and technology and everything. And I know Dr. Jasmine talked a little bit about one of the persons that we highlighted during one of our monthly meetings was Christy, especially when we're looking at suicide awareness. Each month, as I said, I try to focus either on maybe what that health awareness theme is for that month, or just focus on something that, recently happened in the community. As you can see here, these are just a few of the individuals that we had highlighted. Most people weren't aware about the first paramedics, so I definitely did an overview on, the first paramedics, which is a documentary that's out called American Sirens, showing how, during a time when our community was having some racial issues, how, funds was poured into highlighting, the training some of the paramedics and the awesome work that they had done. Also, one month there was considered the great meat out. So I wanted to talk about, okay, if we're not eating meat, then what's happening? So I ended up, doing a segment on Brian Terry, who talked about the Afro vegan. So he went back and did some historical facts on, our roles, especially we know that in the African American community, diabetes and hypertension is a big factor. So I wanted to make sure that we talked about, some alternatives to our health. I also wanted to highlight, as you can see, Lou Gossett Jr. and the work that he had been doing prior to his passing, his foundation to help reduce racism in the African American community. Nina Simone, and most people don't know about Taraja P. and her struggles with mental health. And the problems that she saw growing up with her dad having PTSD, and the foundation that she put together, especially for some of the colleges to bring mental health awareness, because oftentimes there's that stigma, and that's part of one of the things that we do in the African American with AFWAG is to try to reduce the stigma that's associated with mental health and make sure that people know that the services are available. Another part of the work that we do with AFWAG is each month we try to bring in a different speaker to highlight, what's going on in the community, pretty much like what Jasmine did. And Jasmine, Dr. Jasmine, I'll be reaching out to you, hopefully have you come out and speak to the AFWAG group. So as you can see, some of the individual speakers that we had in 2024 that had come out, we had the Black Fatherhood Program, Black Infant Programs, we had the Pearls Program, just a little bit of everybody that had come out, and definitely want to make sure that we talked about some of the services that are happening, excuse me, within Riverside University Health System. As you can see, we had, of course, suicide awareness come out. We had Patrick from the Riverside University Medical Center come out. I think the part that I really enjoy about this is as we bring these individuals together, even though Riverside University is so large, oftentimes they don't realize some of the individuals that are right within that. So I thought it was fantastic when we brought Patrick out because Patrick wasn't aware of the African American uh, our monthly meetings, and some of the individuals within Riverside wasn't aware that Patrick existed. So that was a part of, again, part of our theme to cultivate synergy. How do we bring these different people together, these different stakeholders together, so that we can all say, oh, I didn't know the work that you were doing, so that we can begin to work together and pull our resources together. Because one of the things that I found is oftentimes we were working in these different silos, and part of cultivating synergy is how do we reduce those silos and bring folks together. So we did a lot of partnerships also in 2024. AFWAC partnered with Building Resilient Communities. One of the things that we had noticed that we talked about, especially in the African American community among our African American men, again, we saw the suicide rate going up in the African American community among our Black men. We saw that most of the times our African American men didn't go to the doctors, and when they did, it was often too late. So I partnered with Building Resilient Communities because we were on the same page as far as what do we do to combat the problems that we're seeing with our Black men. So we partnered together, and AFAC was able to sponsor some of the projects that they were doing. And one of them was the Brother to Brother Fellowship Program. This included a series of workshops focused on Black men's physical and mental health. We wanted them to know a little bit more about financial literacy, spirituality, value systems, and more. The program provides peer-to-peer support. Of course, they didn't want any women in the room. It was okay for us to work behind the scene, but they didn't want the women in the room. But we thought this was a great opportunity where the men can come together in a safe space and just have conversation, and talk about what's really going on among them. The program provides, networking opportunity, of course, resources and different tools to support men's overall well health. Also, what Building Resiliency does is they have a monthly African American Health Equity Collaborative meeting where, again, different African American stakeholders, community-based organizations, and faith-based organizations come together on a monthly basis, again, to share resources to kind of reduce those stigmas that we've been seeing in the community. So it was about cultivating partnership. And I'm going to go ahead and bypass the video right now. As the chair for the African American Family Wellness Advisory Group, I found that it was important to not only work locally, but to work on a national level as well when we're talking about health. So I had an opportunity to go to the national some of the national events that were taking place. The first one was with the NAACP, which is the National Association for the Advancement of Colored People, 37th Annual Convention. And mainly they were talking, we need to know what's happening on a national level and to be able to get our voice out there to let them know, what's happening as far as the health in the African American community. So I had an opportunity to go to Los Angeles to hear more about the National Health Leads Forum and what's happening there, and to give voice to what's happening here in Riverside County as far as mental health and health in the African American community. Also had a great opportunity to go to the NCNW, which is the National Council of Negro Women, 61st National Convention. And part of what they're looking at is good health wins, looking at, again, those areas that are affecting the African American community, what's working, what's not working, and to have a voice to say, this is what I'm seeing in the community. This is what I'm hearing from the different stakeholders in the community. So AFWAC is very involved in locally, nationally, and at home as far as those things that are affecting the African American community. One of the things that I don't have up here is also I was working with the California Black Health Network, and we were able to go to Sacramento, and I was very instrumental in working with them on getting a resolution for the Black Health Equity Week, which is the first week in May, May 5th to the 9th, where it's focusing on Black health equity. So that's something that was passed last year, 2024. And as a matter of fact, it's coming up in the next couple of weeks, that Black Health Equity Week. I also wanted to share that some of the other works that we're doing to create synergy both through state, local, and civic engagement. One of the things that AFWAC does is we sponsor various events. These are just some of the events that we were able to sponsor in 2024. AFWAC sponsored the second annual State of the Black Inland Empire Summit that was hosted by Assembly Member Dr. Corey Jackson. This was the one that took place last year. Unfortunately, Reverend Al Sharpton wasn't able to come last year because his father had passed, but they're expecting him to be there this year, and it will be taking place this year in October, and we will be supporting and sponsoring that event again. This summit engaged over 300 community stakeholders and partnered in collaboration discussions that focus on health, housing, barriers of inequality, entrepreneurship, safety, and overall well-being of the African American community. Also working with anti-racist Riverside to celebrate collaborations. Again, it's about not working within those silos. We came together. Did someone have something? Okay, I thought I heard someone. Also had an opportunity to go to the gathering in 2024. Again, this was an opportunity for different community leaders to come together and talk about the state of the African American community. So this is just a couple of the things that we had engaged in 2024 with AFWAG. So last year, AFWAG hosted a Juneteenth mixer. And again, it was focused on cultivating synergy to reducing the silo mentality. As I stated, one of the biggest concerns that we had is working in silos, and how do we begin to build capacity with community-based organizations and seek community surveys and feedback to get an idea of what's going on so that we can present that information back to Riverside County. AFWAC Steering Committee identified and collaborated with key community leaders, educators, and public service officer to serve as a panelist to address historical barriers that we heard Dr. Jasmine speak on earlier. We was talking about what was happening with the stigmas and the mistrust of the behavioral health system that had prevented African Americans from seeking help. And we're finding that mistrust is a big issue in the African American community. And part of the work that AFWAG is doing along with the steering committee is to, how do we get out there and reduce those stigmas that are happening in the community so that our people can, get the services that are available. We engage the community in dialogue and provided surveys to get feedback so that we can take that information and again begin to put together, a platform to say this is what's happening and these are some of the services that we think we need. It was a great event for those of you that had an opportunity to come out. We got a lot of good feedback. We got great attendance on that, and we're hoping to do something similar again this year. So these are just some of, again, a few of the other events that, we hosted, which was the Black Women's Health Summit. We also work with the Black infant. As far as we know, the infant mortality rate is a big issue, a big concern that's happening in the community. And AFWAG wants to make sure that we're in the center of what's happening and what's going on so that we can have a voice in some of the directions and making sure that those services are available and that the information is out there. Here are a couple of other events that AFWAG sponsored. We sponsored over $18,000 in sponsorships. One of the ones that we just had our second annual mental health day at the ranch. It was really successful last year. It was even more successful this year. This just happened last week. We looked at, yes, we know that, therapy is good, but we want to make sure that people understood that there's other forms of therapy when it comes to mental health, as opposed to just talk therapy. We looked at, pet therapy. So one of the things that we did is we found a ranch with a gentleman, African American, that owns 10,000 acre ranch here in the Moreno Valley area, and he was supported in hosting a mental health day. We just had it last week. I think we had over 30, 40 vendors to come out that shared their information on the different mental health services that they provide. We also work with the Amani Maternal Mental Health Project, sponsored one of their events, and they're doing great work in the community, working with individuals on postpartum. As we said, we know that what we're seeing right now is there's been some big issues with infant mortality rates. So AFWAC wanted to make sure that we were involved in supporting that work also. We started working with some of the older adults in the community, embracing strength and resiliency through time, because we're finding that brain health, dementia, and Alzheimer's is a big concern, and how that's affecting individuals' mental health. So that's something that we were doing as well. Also reached out to Temecula. So we're making sure that we're moving around throughout Riverside County to support, to provide sponsorship and work with a lot of the different community organizers. Again, trying to reduce those silos and starting to bring people together. Here are just a couple others events that we were working with, and I'll have Nisha, talk a little bit about this. Some of the work that we're doing. We had one of the programs which was BRAF, Building Resilient African American Community, and of course, AFWAC was got involved in this because we had gotten word that, this program was ending. This was a program that focused on the African American community, and a lot of the community members came together. We had a meeting. It was in person and by hybrid, because people want to talk about where do we go from here? If this program isn't here, then where do we go from here? And as I say, I'll have Nisha to give you guys an update on where we are on moving forward, on how do we begin to replace what we don't have right now, because this is a big concern that's been coming to the AFWAC community, as far as what do we do now that we don't have this program? What's out there? So these are just some other community outreach activities that we have done. As we said, we want to make sure that we're involved in, the suicide prevention, where we're out there making sure that, we're doing our hashtags, where we're making sure that we're putting the information on social media so that the African American community is aware of what's going on, and to making sure that they're involved in the work that we're doing. Also, what we want to do is make sure, working with Healthy Heritage, to make sure that we have a resource list of both clinicians and therapists that are increasingly involved in helping to support clients who are experiencing significant distress, including thoughts of suicide. Although a therapist provides direct counseling to clients, a clinician oversees overall effectiveness of a program rather than an individual progress. So AFWAC is dedicated to ensuring that supportive resources and materials is available to share with individuals. And we're always open to, I'll make sure that I put my email address in there if you want to be a part of this listing, because the resource list is growing. And as we're out there doing community outreach, we're making sure that people, when they ask for where are some Black therapists, where are some Black clinicians, that we have a list available to share with those individuals. And we also know that, AFWAC was built on these various principles. So we want to make sure that we're always supporting, the end of the year Kwanzaa event. We know that unity, self-determination, collective work and responsibility, cooperative economics, purpose, creativity, and faith are the foundation in which AFWAC was started. So we want to make sure that we're supporting Kwanzaa. We're making sure that we're supporting these principles and all the work that we do to serve the African American community. So this is just an overview of some of the work that we did as far as cultivating synergy in 2024. And as 2025 rolls around, our theme this year is the year of the ripple effect. At AFWAG, we understand the profound impact caused by a single action, which can create a far-reaching and enduring ripple effect. We truly believe that the continuing and spreading result of an event or an action taken has the power to impact another in a positive way. And that's what our goal is this year, the year of the ripple effect. As we said, we're doing some community needs assessments that we're putting out there. We're wanting to get feedback from individuals. We're wanting to work with, again, all the different communities, especially our older adults. And we basically, one of the first things that we did this year, we did a big summit on what's really going on to have that conversation, because there's been a lot of concerns, especially with the political climate as far as what's going on. Some kind of some worries, so we wanted to kind of have a open conversation, a real conversation as far as what's going on. What we have coming up is a conversation cafe that we're asking folks to participate in. A couple of years ago, there was a big survey that went out as far as listening to Black Californians. I'm not sure if any of you guys were familiar with it. And it really just put some information out there as far as how African Americans feel about, again, going to the doctors and not getting the services that they're needing, not getting the medication, being sent home, and having to go back because doctors are not listening to them. So as a result of that, working with UC Irvine, they're wanting to work with AFWAC to say, look, we want to come to Riverside and have the conversation to find out, how do African Americans feel, as far as, when we're talking about listening to Black California. And their focus, again, is on the older African Americans. So that's coming up May 14th. I'll make sure that this information is sent out. So if anybody's interested in participating in the conversation, we would love to have you all have a seat at the table to talk about what's going on. And again, want you to save the date for June 19th. This will be our third annual community service and recognition ceremony. One of the things that we incorporated is to say, we will appreciate the work that the community-based organizations are doing, that the faith-based organizations are doing, that those grassroots organizations are doing, and we like to bring them together and say thank you for the work that you're doing, and all of those that have come out and spoke at the monthly AFWAG meeting. This is an opportunity to show our appreciation. This is an opportunity to bring everybody in the room together to have a conversation. So this is something that this is our third annual Community Service Award event. Again, I'll make sure that this information goes out and that you guys are all a part of that. And if you're interested in coming to one of our meetings, AFWAG meets the third Wednesday of the month. We're currently meeting via Zoom. From time to time, we do meet in person, but we meet the third Wednesday from 10 to 11:30 a.m., and you're more than welcome to come. Again, we have a steering committee. We're always looking for individuals to be a part of our steering committee. If you're interested, again, I'll put my email address in the chat so that you can be a part of it. And I'm going to go ahead and turn it over to Nisha to see if she wanted to add anything, or Nisha, if you wanted to give an update on where we are with the information as far as the new RFP that we're looking at.
Thank you, Ms. Hazel. I just want to say you did a beautiful job of summarizing and highlighting the things that AFWAG did last year and our goals for this year. So thank you so much for doing that. So thank you for allowing me space and time. As Ms. Hazel stated, BRAF was one of the programs that we had in our department for African American families, and it ended last year. And so the community was voicing their concern about not having an African American program in Riverside County. And we heard them and we listened to them. So with that being said, we decided that we wanted to go grassroots level and find out what really does the community need from a qualitative perspective. So we want to know what the community is saying. So Ms. Hazel, myself, Diana, PI, her program has been working closely together to develop a research proposal. So we are currently in the process of developing and finalizing that proposal so that we can get the research done in Riverside County to identify what our African American and Black families are saying that they need so that they can get connected to service. Because our real goal is to reduce the disparities of getting service from public behavioral health. And so we want to know what the community is saying. We're also interested in knowing what are the gaps? What are some of the reasons why they are not coming to get services? Or what are the services maybe they have heard of that we might offer? So we want to hear all that feedback so that we can make sure we reduce the disparities as well as talking about stigma reduction. We want all of that to be incorporated in what we provide our community in the future, because ultimately we don't want to just start a service and say, hey, this is for the Black community. We want to say, what is the community asking for, and can we develop those services and offer it to our community? So I'm very happy with Dr. Brooks Stevens' presentation, how she highlighted the somatic and body-based approaches and the acceptance and commitment therapy principles. I'm wondering maybe our community will say, these are the things that we need, and we can really lean into those treatment modalities or interventions. So we are at the stage again of doing the proposal, and so we will be putting it out. I'm not going to say a date because I don't know. We're going to ask for people to respond to that proposal to see if they would be a great match to do this research. So thank you again, Ms. Hazel, for this time, and you'll be hearing from us soon about that research project. Have a wonderful rest of your day.
Terrific. Thank you so much, Hazel and Nisha, for being here today and sharing the incredible work of AFWAG. Who has questions for Hazel or Nisha? Feel free to unmute, raise your hand, or put it in the chat. Questions or comments? All right, well, while you're all potentially thinking about or typing in questions, I want to thank you again, Hazel, for presenting with us today. And I want to share with you some upcoming activities and events in related to the Suicide Prevention Coalition. So I want to remind you about some learning opportunities that are always available to Riverside County community members, those who live or work here. We have an ongoing calendar of free trainings. Know the Signs is our 2-hour kind of introductory training that's available both virtually and in person, that talks about warning signs and learning how to ask directly if someone is having thoughts of suicide. And then our Safe Talk, which is an in-person workshop that helps individuals to learn more about those warning signs and begin to have those direct conversations and connect someone to the resources to get help. And then Assist, or Applied Suicide Intervention Skills Training, is a 2 full days in person that not only teaches those things Know the Signs and Safe Talk does, but then when the answer is yes, I'm having thoughts of suicide, helps individuals learn how to develop a safety plan for now, to keep someone safe for now until they get connected to more long-term help. So those things, you can scan that QR code, get access to our upcoming calendar, and we will have lots of things coming up, especially in May, as May is Mental Health Awareness Month. So if you have questions, you can email us here at our main inbox or phone number and get all your questions answered. Some other events coming up, I want you to save the date. We've been working closely with the American Foundation for Suicide Prevention, our local Tri-Counties chapter. They have an upcoming virtual hike for hope on May 31st. So if you like to hike and you want to use your energy to share awareness around suicide prevention, scan that QR code to get more information on how to get involved with local walks or how to start your own. And for the third year, I believe it's the third year, the Suicide Prevention Coalition will be sponsoring the Riverside County Out of Darkness Walks in partnership with AFSP. We have 2 walks in Riverside County. The Coachella Walk on October 25th has been around for a very long time. And in the last 3 years, we expanded to include a second walk on the western end of our county. That's in Fairmount Park at the beginning of October. Scan your QR codes to get access to sign up. They are free. They're fundraisers, but you're not required to do it to participate. So if you're interested in being a part of a community of suicide loss survivors, we talked about that today, postvention, and that's really what Out of Darkness walks are about, bringing together suicide loss survivors to join in community, to remember those that they lost, and to also share information to prevent future suicides, because postvention is prevention. How do we make sure that we don't see more suicide deaths? And then just another kind of save the date, International Survivors of Suicide Loss Day happens every year through American Foundation for Suicide Prevention. November 22nd is the date, and our local chapter is working on the details of what that date will include here in Riverside. An additional save the date, our next quarterly meeting is July 23rd. We are still finalizing the details of what that topic will be, but you can sign up for it now and trust us that we'll have some fabulous information for you. And then we'll send out more additional information once we have it. So you can scan that QR code. And anyone who's new with us today, your email address will be added to our email list. So you will get future communications from the SPC about these and other activities related to the SPC. So just as we close up, I want to remind you about our website, rivcospc.org, where you can find all of this information, where we do put the recordings of our quarterly meetings up. You can also join a subcommittee and by scanning that QR code, visiting the website, and signing up. We would love to have you help us out with this work. We do have a survey. I think you're going to get a QR code in the chat from Hazel. So she's going to ask for some feedback about her presentation specifically. And then this survey is about our entire time together this morning. Dr. Brooke Stevens, the data, and our overall quarterly meeting. So we ask that you complete that. We really do read these and use them. We'd love to hear from you, not only about how this went for you and if it was helpful, but also what you want to learn about more. The coalition is dedicated to quarterly meetings where the goal is to bring in information to help build our local community's expertise in suicide prevention all across the whole suicidal crisis path, so that we can work together as a community to eliminate suicide in Riverside County. So having shared all of that, I want to take just a moment to see if there are any additional questions, comments for any of our presenters, or the co-chairs of the coalition.
I just want to respond to a couple of comments in the chat.
Okay.
I put my email address and consulting@yahoo.com. If anybody's interested, I saw in adding their information to the list, just go ahead and email me.
All right. And also someone's asking about how to get more information about the Black American Inland Empire Mental Health Professionals list.
That's the list I'm referring to. They
Okay.
can email me and I
Perfect.
can make sure that I send them a copy.
Great. Lots of people saying thank you. I've learned valuable information. And first learning about AFWAG and being able to be a part of that. Terrific, terrific. Thank you all so much for being here today. And yes, Marilyn, we will be sharing the recording after the meeting. So if there isn't any other comments or questions, thank you all so much for being here today. We really appreciate it, and we'll look forward to seeing you at the next quarterly meeting. Have a great rest of your day.
Great presentations. Thank you, everyone.